Today I'm going to demonstrate a back exercise, kind of a core exercise that I found kind of by accident. I was reading a book about handstand and hand balancing, and was trying to work on getting better at that, and this helped tremendously. But what I didn't expect was that it actually helped my lower back and a lot of pinching that I didn't really realize that I was having, and a lot of my shoulder issues and just general spine issues that my chiropractor sees every time I come in. But also I've had a lot of issues back and forth between feeling like I have a bladder infection when I don't, just that kind of like oversensitive, urgent bladder feeling, also feeling completely overstimulated with like sexual sensation, or feeling just only pain, especially with intercourse. And so when I started actually really working on these exercises, a lot of emotional stuff kind of went through me over the course of really strengthening this core spot that I never ever found before. And also a lot of like pleasure and sensation came back, and I started figuring out it's kind of subconscious, like wiggling my ears when I can't feel that muscle, but there's a way that I can actually hold my back during sexual experiences that will turn kind of overstimulation or irritation and agitation into pleasure. And it used to, like, I could do it and then it would fatigue out and I would just be feeling uncomfortable again and have to remember to do it again. But now it's gotten a lot stronger. And it's just been incredibly helpful and eye-opening how much this really helps my core strength, keeping just everything during fitness, exercise, that kind of stuff. And it's not something that I actually heard of or have seen in like the millions of different videos and exercises and core strengthening exercises, all that stuff that I've seen before. So I wanted to specifically demonstrate this, and if you try it and it really helps you, please let me know, or if it doesn't, I'm happy to talk to you, troubleshoot, discuss, etc. My husband does this as well. I think it really helps with kind of a strong curve in his back, but it's actually really difficult for him. He's really tight. He's very muscular and it's very difficult for him, but having him practice it as often as possible. And I practice it kind of daily. It helps me with my handstands, but now that I'm pregnant, I would like to have the most chance possible of feeling pleasure during birth instead of pain. And I really feel like, obviously, if I can go with intercourse or sexual experience and just slightly move my spine in a way, and my core in a way where it literally will change pain and oversensitization, just feeling completely blasted and overdone, to pleasure, and it just turns everything on. I feel like it would really be important with actual baby sending and crowning and opening, and I can see that if I never figured this out, how I would obviously have a very painful childbirth. So I'm still only 15 weeks, got a long ways to go. When I actually give birth, I'll let you know how it goes, but this feels like a really important piece, so I wanted to share it and give you a visual demonstration. So without further ado, I will be demonstrating the back against the wall, flattening my back exercise that I do. So for this exercise, you're going to need a wall or a door frame. A door frame is fine, but just a flat wall without any obstructions of switches or anything. And you're going to want to put your feet, you can start with your feet kind of further out, but I can at this point do it with my feet kind of close in and about hip width apart. And when you just lay against it, got a rather large back end, and when I lay just against the wall like this, there's this big gap between my back. And anybody who's done core work, like on the floor, they have you flatten your back against the floor. What I never realized is how much you're dependent on having your arm. I was dependent on having my head up and my shoulders up to just like round my spine, versus being able to really hold a hollow body, which is with your your head back. So when I first started to do this, it was literally impossible. For like the first 20 seconds, I had to just lay here and try to figure out unconsciously, get my body to cooperate and actually flatten out with my head, my shoulders, this part of my back, and my butt. So 2 ways that I go about it. One is to kind of roll like this, which will usually cause my back to pop back out when I hit my head against the wall, when I put my head against the wall. The other way is once I get my head against the wall and my shoulders, I will pull my hips forward like this and rotate forward, and then I'll roll my back down. Keeping my head and my shoulders against the wall, I'll roll my back down. So this was very hard for me to hold at first. So, you know, this may be your first step and you may need to move your legs out more. The further you move your legs, the easier this is going to be. So if you're like, this is really simple, you know, put your legs up against the wall. Now I can't do it. So I need to have my legs about a foot, my feet about 1 foot from the wall. And then that's about my sweet spot for it. This is kind of difficult, but I can do it. Once you get this, and this is something that you can maintain for a few seconds, or for, you know, kind of indefinitely. It's a little tough. What you're going to want to do is holding all of this. And you can see that my core, I'm not holding my stomach in, and I'm 15 weeks pregnant, so my stomach's been, you know, sticking out a lot. I'm not holding my stomach in, but it's just something that's involved in creating this flat, hollow body. So you want to kind of brace this and lift your arms without coming up off the wall. So it's really easy to do this, but that's not what you want to do. You want to keep your spine against the wall, your head and your shoulders, and then, I brace my whole body to do it. So you hold on and slowly lift your arms up until they're straight ahead. And so usually in the morning, this is really hard to do. And sometimes I have to do breath work in this position and hold a deep breath and move around, and I'll have ribs out of place or my shoulders will catch. Different things I could tell will prevent me from having good posture. But if I hold my breath and keep sucking in more air as much as I can and wiggle around, things will usually correct themselves. So you lift your arms up above your head while keeping all of this flat. It takes a lot of time and concentration to get this down. And then you kind of hang out here, and I would hang out here for about 60 seconds if I possibly could. Some days I can't, but it's exhausting. And you hold it for that long, and when you finally let go, it's just so much pinching, so much stuff that needs to be strengthened. To be able to hold yourself in that position and hold yourself with your arms up is obviously a lot of work for your body. I do this exercise daily if I can remember, like first thing when I get up, to kind of put everything in place in the correct way, and I've gotten much stronger. This helps a lot with my stance when I do handstands, and it helps me remember to, I stand like this quite typically, so that's where all the pain and the pinching in my back, it's just so compressed. So I've learned to, it's even hard to tell you what it is exactly, this motion that I do, but it's like pulling my rib cage down and my hips kind of forward and my belly kind of in, but I'm not actually, I'm not rocking my hips forward purposefully, and I'm not sucking my stomach in. Those things never really did me any good. So it's kind of, if I realize that I'm, my stomach feels really distended and I'm holding my back, really arched and it starts to pinch or whatever, I just kind of breathe in and just kind of think about that back against the wall thing. It's more of pushing my spine out, and my hips come in for that and my abs come in for that. And when I've seen Katie Bowman and her exercises she has you do for pregnancy and all of that, it's pretty much literally that. You stand, you rock your hips kind of forward, you push your spine kind of back, and your shoulders back. You're literally creating the same stance that I was just doing on the wall. So it's obviously very important. It's obviously very helpful. And now when I'm actually, laying on the bed, I can tell when, when I feel this like kind of down and through, and I can feel it down through my pelvic floor, and it just turns sensation from really painful to actually really positive, which is something that I am incredibly relieved for, because I've gotten really tired of a lifetime of random long extended periods of time where I only experience pain and feel like I have to pee every 5 minutes, or, different things like that. So this has been an absolute lifesaver for me, and I hope it works well for you. Again, I'd really like to hear anybody's feedback. I'd really like to know if this is something that like universally helps a lot of women, or if it's really just me, because it quite possibly could just really be what I needed. You know, I can tell my lower spine pinches nerves that go to the rest of those important organs, and they can't get the sensation going between, you know, sensation and brain correctly. So let me know what you think, and if you have any positive or negative experiences trying this. So thanks.